Good afternoon. Thank you for joining us once again. We've got a lot of material to go over. I won't drone on, but I do, as we've gone on and over earlier today, a lot of our numbers are trending, continue to trend in the right direction. I'd like to think that it has something to do with how we're responding to the virus itself and the actions and precautions that we're taking. But this is an ever-changing time and environment and virus, and as we've talked about for months on end, it mutates, and we have to be prepared for that too, which many project to be more in the March timeframe when the madness is truly upon us. Even more important now to continue on the path that we're on and continue to watch these numbers drop while these new variants are working on our way. But you want to give us an update on where we are numerically?
Sure. Thank you, Governor. Good afternoon, Hoosiers. Nearly 737,000 Hoosiers have received their first dose of vaccine as of today. That's an increase of nearly 126,000 from last week. Of those individuals, more than 258,000 have received both doses and are fully vaccinated. It's incredibly exciting to see these numbers continue to climb. Between mid-December, when we first began offering vaccines, and the end of February, nearly 1.4 million appointments have been scheduled. That total includes 57% of Hoosiers age 80 and older, 64% of Hoosiers age 70 and older, and 55% of Hoosiers age 65 to 69. The number also includes about 68% of eligible healthcare workers and first responders. In addition, nearly 81,000 doses have been administered to residents and staff in long-term care facilities. That includes both first and second doses. We are currently receiving about 100,000 doses of vaccine each week. Because supplies remain limited, we will keep our current eligibility at 65 and older this week so that we can fully analyze the number of second dose appointments against our existing and our projected inventory. Our goal is to ensure that we have all of these second doses covered before expanding further. Dr. Weaver will talk more about the next steps in our eligibility shortly. We continue to see improvement in our positivity rate, as the governor was saying. Today, it stands at 6.2%, which is a significant drop from last week's rate of 7.7%. We have also seen a decline in the number of Hoosiers hospitalized with COVID symptoms. About 1,300 Hoosiers were hospitalized with symptoms of COVID as of yesterday, down from 1,600 last week. Our daily hospital admissions continue to remain below 200, which is welcome news to our hospitals, as they were seeing more than 500 new COVID admissions a day in early December. Our color-coded county maps continue to improve. This week, just one of our 92 counties is in red on the 2-score map, down from 4 last week. A month ago, 73 were in red. And finally, we have a county again in blue for the first time in months. We also have 50 counties in yellow this week, a significant improvement from the 29 that were in yellow last week. Our advisory map, which indicates the level of restrictions that counties must follow, shows 64 counties in orange, down from 78 last week. Only 4 counties are in a red advisory level, while the other 24 have moved to yellow. Although we are encouraged by these positive trends, we are heartbroken that Hoosiers continue to lose their lives to this disease. Today, we reported another 52 deaths, which brings our total lives lost to more than 12,000 when you include both confirmed and clinically diagnosed deaths. Finally, I would like to update you on the distribution of masks and BioNX Now cards that I mentioned last week. This week, we also began our distributions of KN95 masks to critical infrastructure and schools. Our schools are also receiving the BioNX Now cards, which are rapid tests. All of these supplies are being provided at no cost to schools and businesses. So far, more than 280 critical infrastructure requests have been received for masks, and we've begun shipping to more than 80 locations. More than 250 school districts have also responded to our survey about the masks and now BioNX Now cards. 11 of those districts should be receiving shipments by tomorrow, and more than 330,000 pieces of PPE and BioNX Now tests will be shipped by Friday. We will continue shipping supplies to schools over the next few weeks. We also will be sending a survey to all non-public schools this Friday to gauge their interest and needs. And we're working to include early childhood centers in future phases. We have spent a significant time over this past week talking with schools about the new options for quarantine if a student, teacher, or staff member is symptomatic. As a reminder, quarantine and contact tracing is not required for an exposure in a classroom setting if everyone in the classroom remains at least 3 feet apart and wears a mask at all times. In addition, we have explained the CDC's new options returning after 10 days or 7 days under certain conditions. These have generated many questions, and our goal is to answer them as thoroughly as we can so that school districts can make the choice that is best for them. I want to emphasize again that the Indiana Department of Health and the CDC still believe that 14 days is the safest quarantine option because the risk of spreading disease is very small when you return beyond that point. However, we want to make it possible for an asymptomatic individual to return after day 10 or on day 8 if certain conditions are met. The primary condition is that the individual has not developed symptoms and that everyone remains masked in a classroom for the entire time. None of these changes are mandatory, and the policy decision is ultimately up to the school district. No matter what option you choose, please remember that COVID-19 is still out there and we need to stay alert. We have now seen more than 930 cases of the UK variant nationally across 34 states, including 12 now here in the state of Indiana. Several states are also reporting cases of South African and the Brazil variants. All of these variants are more infectious. So even though you may be tired of hearing it, please keep wearing your mask, practicing social distancing, staying home if you're sick, and getting tested. Get tested if you have symptoms. Our daily testing rates have been declining, but there are still plenty of free tests available right now. Thank you.
And with that, and you mentioned a week ago, in terms of our positivity rate, a month ago, going to January 11th, it's the 10th today, so January 11th we were at 16.5, so today 6.2, so 10.3% drop. But again, when you look at it over month by month by month over the last 10 plus months, there's this ebb and flow, and we want to be in a good spot, not just today, but a month from now when March Madness is upon us. With that, we'll go to Dr. Weaver. Dr. Weaver?
Thank you. We are very excited that we have over 50% of our 65 to 70-year-old Hoosiers either scheduled or have received their first dose of vaccine, and over 60% of our 70 to 80-year-olds. We continue to see these numbers slowly rise, and we are happy that those Hoosiers who are the most vulnerable for hospitalization and death will be protected. As previously announced, our plan remains to use data to inform our eligibility guidelines. As soon as possible, we plan to decrease the age of eligibility to include Hoosiers 60 to 65. This group includes approximately 432,000 people. Vaccinating Hoosiers aged 60 and older targets a population that accounts for 93% of the deaths here in Indiana. This week, the Indiana Vaccine Advisory Committee met to discuss next steps after we reach age 60. When we have enough vaccine and have vaccinated an appropriate portion of the 60 to 65 age group, we will then incrementally expand eligibility to 2 additional groups: Hoosiers age 50 to 59 and Hoosiers under age 50 who suffer from certain comorbidities. In Indiana, people who are age 50 and older make up just over 35% of the population, but account for 80% of COVID hospitalizations and 97.6% of our deaths. Our data show that Hoosiers age 50 to 59 are 30 times more likely to die of COVID-19 than people aged 20 to 29. They are 4 times more likely to be hospitalized than the 20 to 29 age group. By making Hoosiers age 50 and older eligible for vaccine, we are capturing 82% of the state's population that suffers from any comorbidity that increases their risk. Nearly 858,000 Hoosiers are in their 50s. So expanding to this group will be a large undertaking that will require ample supplies of vaccine. Again, I urge you to please be patient while we wait for those supplies to arrive. In the other group that will become eligible, we are targeting an estimated 51,000 Hoosiers with specific conditions that put them at increased risk of severe illness. These Hoosiers have 4 to 10 times increased risk of death if they were to be infected with COVID-19 based on our own state and international data. Our group will include people receiving dialysis, people with sickle cell disease, people who have received a solid organ transplant, individuals with Down syndrome, people who are actively receiving cancer treatment now or within the last 3 months, and people with active primary lung cancer or an active hematologic cancer, such as lymphoma, leukemia, and multiple myeloma. We will be working with medical providers who treat these individuals and the associations that serve these people with these conditions to identify the best way to reach out to these individuals directly when they are eligible. Again, this plan was deemed best after advisement from our State Vaccine Advisory Committee, which consists of experts in infectious disease, critical care, immunology, and ethics, as well as the advisement of Indiana leaders in oncology, solid organ transplant, sickle cell, and dialysis. I want to remind Hoosiers that our original vaccination plan had outlined that after vaccinating Phase 1A, which was our healthcare workers and first responders, that we would vaccinate individuals who are at particular risk of severe illness or death associated with COVID-19 disease based on the latest evidence-based criteria, and that is what we are doing. We continue to use data to drive our decisions. We reviewed risks based on age and the CDC's list of conditions that lead to an increased risk of severe illness from the virus. We know that these categories do not include all Hoosiers who have conditions that could put them at greater risk from COVID, but we are working to expand to those most at risk as quickly as our vaccine supplies allow us to do so. We're hopeful that more vaccine could be on the way in the near future. Johnson & Johnson has applied for its emergency use authorization from the FDA, and a meeting on that request is scheduled for the end of the month. The J&J vaccine is a single-dose vaccine. It is easier to bring to people and for one-time vaccine than to coordinate inventory and scheduling for 2 doses. It also has much less stringent storage requirements and can simply be refrigerated. The Johnson & Johnson vaccine is 85% effective in protecting against severe disease at day 28. And the efficacy against severe disease increased over time with no cases in vaccinated participants reported after day 49. There were no hospitalizations or deaths in people who had received the vaccine. We have come a long way since our first vaccines arrived in December, and we still have a long way to go before we can say with confidence that the worst of this pandemic is behind us. Please continue to be patient and know that we are expanding vaccine eligibility as quickly as our supplies permit. Thank you.
Thank you, Dr. Weaver. And just you both, earlier today I asked, are we ready when that happy day comes where supply, some suggest, will outstrip demand? And you both simultaneously answered me with the same thing, which was...
Absolutely. We have been ready. We're more than ready for that. We have 290 sites now with the opportunity to expand that 3 or 4 times, and the ability to get our 10 mobile vans that are just sitting there not being used right now, each one of them the ability to be a mass vaccination site because we don't have vaccine.
And maybe also because some people are tuning into not just 2:30 today, they're getting their news from other sources as well throughout the day. Good. You might both want to just touch on before we get to, and by the way, Dr. Dan is with us, Roseniak, and Chris Johnston with the OMB. But talk about the other federal sites that may come online at some point, how it doesn't take away that 105,000 doses we're getting every week. But to your point about we were just, seemed like a couple days ago at 259 sites. Now we're in 290 plus with the ability to go to ultimately 1,000 if we needed to be, but with these mobile sites. But how will those pieces all snap together as we see it right now?
So those are federal programs that we haven't had a lot of insight into or input, but Lindsay, do you want to share what we do know about those sites?
Yes, so the federal program is a partnership with pharmacies in all of the states. They will be receiving vaccine and starting, from what we hear, on Friday, and that will add an additional about 160 sites across the state, pharmacies that will be receiving vaccine, and will be giving vaccine along with the state's eligibility criteria.
Yeah, important, and you alluded to this, but in these sites where they may go, we're there now and have the ability to be
Right.
there.
Well,
Yep.
another federal program is the,
AFQ.
they have stated that they're going to give vaccine to our federally qualified health clinics and community health clinics. And realizing about 4 weeks ago that many of those sites are in areas of our lowest socioeconomic populations, higher minority populations, Dr. Weaver and her team very wisely reached out and engaged them to give vaccine not just to their patients, but to their communities in general because of their locations. And so they've been actively engaged with us in 44 different sites already to this point.
Yeah, when we did the task force, I mean, you were looking at this from the very outset, which I literally got the question from Jeff Zines, who oversees the COVID task force, our federal partners in the administration, and he said, what do you attribute your success to? And so they recognize what we're doing here is working in our approach. And of course, we want more.
Yeah.
We want more, we want more, we want more. And I've pledged that we're going to work with them to do just that.
Dan Klein, Wish TV.
Dan, good afternoon.
Good afternoon, Governor. Thanks. Good afternoon. Can you hear me?
Yes, sir. I
Good
could.
afternoon, Governor. Can you hear me?
Yes, sir.
I'm sorry, I pulled out my earphone. Can you hear me now?
I can hear you loud and clear. Third
Okay, sorry.
time's the charm.
All right, perfect. Thank you so much. Two questions. One, first is just about the other strains. You know, if we go back, 10 or 11 months, it almost feels like, does it feel like deja vu to have just a few cases? And are you seeing a large spike coming? And what your thoughts are about the risk of other strains? And then two, my other question is, what type of data are you able to use to determine that higher risk? Are you just using Indiana cases? Are you using federal numbers from around the country? How are you able to figure out just those higher risk factors and comorbidity factors?
Okay, so I'll answer the first one and then we'll go to Lindsay for the second. But the variants, when we say that we have 12 cases here of the UK variant or the B117 variant, we know that there are many, many more cases than that, right? And we do know that it is a much more transmissible virus because we have other countries that we can look at and see what the increased transmissibility was with and is with those variants. To date, in Indiana, we have not identified the South African variant or the Brazil variant, but we are investigating that and screening on a regular basis individuals that we believe could have, by travel history, been reflective of having these different strains or by the fact that we have a cluster of individuals. So we are in the process of doing genomic testing here in the state and also sending some of that to the CDC. So we're always looking closely. I think the important thing about the variants is that it's kind of a race. We're trying to get as much vaccine as we possibly can into the arms of those individuals that we know are going to have the most adverse reaction to getting sick with COVID-19. And it's very important that we do that. But we do know that our mitigation measures, that masking, socially distancing, washing your hands, staying home if you're sick, and getting tested work with this strain just like the wild type, the main strain that we have been seeing all along. Lindsay, do you want to answer the other questions about the different risk factors?
Yeah, so throughout the entire time as we've been deciding who are the most vulnerable populations, we were reviewing the CDC's list of high-risk conditions that could lead to severe illness. And they have a list that is being updated on a regular basis on their website. And then comparing that, of course, to what we know as well to be risk just based on age. So up until this point, really age has been much more so the driving risk factor. When you look, though, at that list of the CDC comorbidities, that's 2.14 million Hoosiers that could potentially be on that list. So it's way too big of a group to just, open it up to all of them. So we really needed to break it down, knowing that we're still getting just a little over 100,000 doses here in Indiana, first doses in Indiana every week. How do we break that down into groups to make sure that we really are going after those who are the most at risk. So in reviewing the age breakdown again, we still found that the 50 to 60-year-olds still had an increased risk just based on their age alone. And then, of course, notice too that 82% of the people who meet the criteria of that CDC risk group, 82% of them are in that 50 and plus group. So we know that we're going to get the vast majority of those people with, coronary artery disease, heart failure, COPD, just by doing the age increments that we are. And then we identified those other high-risk groups and spoke to their providers across the state and really found that several of these groups have to have specific timing for when they get the vaccine based on when they receive medication or when they've received their transplant. So know that we need to coordinate those groups very carefully. And so that's how those decisions were made.
Yeah, and Lindsay or Chris, just to put a fine point on that, once we get to the point to where we're doing 50 and older plus comorbidities, you will have addressed 98% of the
deaths
death
that have occurred.
risk. Yeah. And then your task force you won't wait until then, but then you'll be making decisions about how to move forward when we get to that point. So we're hoping for more
And based on how much vaccine we have, right? If we do
Ex-
get a significant influx of vaccine because we get more vaccines in and we see increased production, say, of the Pfizer virus or vaccine, that'll be great.
It's really important because of kind of how we stress test our system here to make appointments along the way, very methodically, through 211 or going online, scheduling, and that is held. And so as we add hundreds of thousands more in their respective buckets, that's why we can continuously adjust to adding however many doses we have, not what we want.
And we may get to the point with mass vaccination sites where we
Right.
continue to register them as they walk up. If we have tons of vaccine and there's sites all over the state being able to do that.
Keeping my fingers crossed for that scenario. Go ahead.
Rob Burgess of the Wabash Plain Dealer.
Good afternoon, Rob.
Good afternoon, Governor. Good to be with you again.
Good to be with you.
Yeah, so last week, 2 tigers at the Fort Wayne Children's Zoo contracted the virus. What do we know about the transmissibility between humans and animals? And how does that relate to the potential for new mutations as it goes back and forth between the two?
So we do know that animals can get the virus from us. Early on, there was some data that showed that we could infect our dogs or our cats. I have not seen to date that we are confident that that same infection from the animals to us has occurred. And I'll flip that over to Dr. Weaver just to see if she's heard anything different. But it, I know that, for instance, my niece's dog got very sick when she had COVID, and that dog was kissing her and licking on her in bed with her. And I said, that dog's going to get sick. And sure enough, it did, just about a week or two after she was through. So I do warn people that if you're sick with COVID, potentially you could make your animals sick with that. But it's highly unlikely anybody's getting that close to the tigers, I hope.
Lindsay looks like she's brushing that pitch off. Yeah, okay, moving on.
Casey with the Associated Press.
Good afternoon, Casey.
Good afternoon. You touched on this a little bit earlier, but in regards to those new White House plans to have 100 federally run vaccination centers operating by the end of the month, I'm wondering if Indiana has requested one or if the state will request any and why or why not.
Yeah, this is their initiative, and we've been on multiple calls with them, and we're pledging to work with them. It starts out as kind of a pilot. We're doing a lot of what they intend on doing already. Maybe some states aren't, and so they're trying to fill that void or address that need. But they have also pledged to me that they'll continue to evaluate this on an ongoing basis to make sure that it's efficient. What we don't want to have happen is there to be any confusion. We want reality to meet expectations of folks who are looking to get vaccinated, and we don't want a drag on our reporting, meaning if you go to one place and it takes 3 days for us to then report it when we've got a system down that is much more immediate than that, and we have the ability to right now move vaccine to places of need. I mean, you talked about
We try to keep it very proportionate. You know, we try to look at the percentage of healthcare workers in a particular county or the percentage of individuals over a certain age, and then try to make sure that we are equally allocating that vaccine across the state of Indiana. And we are working with FEMA and have submitted a request to FEMA for some financial support of our mobile sites and the mass vaccination that they'll be able to do.
Yeah, so, Casey, we're not going to turn down help. We want help. We want more. We know there's a way that we can continue to work together, and I appreciate their. Look, I sent Jeff Zients a letter electronically and mailed at 10 a.m. last week on, I think it was Tuesday, requesting a time for us to discuss just this matter. And by 2 p.m. we were on the phone that day discussing this. And then we have with governors around the country on our National Governors Association. So I'm not sharing anything that other governors haven't also expressed. And the good news is that we're talking on a very regular basis and wanting to make sure that we're the most efficient and least confusing process out there. Right now we got a good thing going, and I want to accelerate it.
Kathy with the Ferdinand News.
Afternoon, Kathy.
Good afternoon. Hope you're both doing well today and it's not too icy in Indy. It's getting bad here.
It's getting cold. Stay safe.
Yes, you all too. I have a question about the Lilly therapy that was created a couple months ago. We hear nothing about that. I've heard of no one who's been treated with that. That could just be in my area, but I'm just curious if that's still being used for the mild to moderate cases.
Absolutely. In fact, Indiana has, I think, the largest site in the nation that is actually giving that monoclonal antibody. And we have partnered with with admission sites all over the state that can actually give this drug, all associated with hospitals. And every week, it's 2 weeks now, we get our allocation. Every bit of it goes out because all of our systems are asking for that for their infusion centers. So those individuals that are at risk and that are not hospitalized, don't have to be on oxygen, are the perfect candidate if they have underlying comorbidities.
You want to talk about what was just approved? Speaking of Lilly, we're very proud.
Right.
Yesterday, last 24 hours.
They will be able to actually administer both of the monoclonal antibodies together, which has already been happening with other antibodies and has shown an improved effect for individuals. So we're really excited that that approval and EUA has come through for Lilly.
Yeah, I hope you hear more about it, Kathy, because I'm not a doctor, but I don't think it's any coincidence that our hospitalization rate has ticked down too with these therapeutics.
Yeah. Many of the hospitals that do a lot of this believe very strongly that this has made a significant difference in their number of hospital admissions they've had.
And,
Lauren Chapman, Indiana Public Broadcasting.
Afternoon, Lauren.
Good afternoon, Governor. How's it going?
So far, so good. A lot of day left.
There is. I wanted to ask. You were just talking about the improvements in Indiana's numbers. Testing has significantly decreased, and so I'm kind of curious, given that Indianapolis is hosting March Madness soon, given all that we are preparing for as a state, what the state is doing to encourage people to go get tested. Is there any potential campaign for getting folks tested, especially with these new virus strains? I would imagine with something that is more easily contagious that you would also want folks to go out there and get their nose swabbed.
Mm-hmm.
So we still administered about 38,000 tests yesterday. It's just that our positives are really down. We're not doing 50 or 60,000 tests, which we were at one point. But most certainly we are continuing to message to all of our providers across the state, to hospitals, emergency rooms, that if they have a symptomatic individual, to get them tested. We have not changed anything about our sites. We have not decreased the number of sites that are testing or the number of hours that they're testing because, number one, we want to remain prepared for what might come our way. But number two, we want that to be easily accessible to Hoosiers all over our state.
Andy with the Daily Journal.
Afternoon, Andy.
Hi. I just had a quick question about schools. I understand that schools could request these masks, and I understand that they submitted their student numbers. Are you guys sending one mask per student, or how is that working? How are you guys determining how many masks you're sending based on the student body? And then I also wanted to know, when is the latest schools will get their supplies?
Great questions.
I think those are great questions. It will depend on when they request them, right? So we are committed to sending these out as we get in information about what schools want these. We're reaching out to them. If we get to the point where we haven't heard from certain schools, we may just go ahead and send the masks along to them and the hand sanitizer. But with regards to the children's masks, we had about 600,000 of those, so those will be divided up proportionally. With regards to the KN95s, we're hoping to give about 10 masks per teachers and administration and staff.
Whitney with CNHI.
Hello, Whitney. Thanks for joining.
Hello, good afternoon. My first question is about how are we going to be able to, quote unquote, screen people for comorbidities at testing sites? I know that they can't technically get the appointment until their provider helps arrange it, but how are we making sure that people at sites now are the ones who qualify for eligibility? You know, it's not, you can't check this on a driver's license.
Lindsay, do you want to address that?
Yeah, so we, like I said, are working directly with the providers who know these patients very well and communicate with them on a regular basis. So those lists of comorbidities, by the nature of their disease, have to be pretty plugged in with providers. And like I said, we're also working with the association. So they're going to receive direct outreach. So they will have communication and will be able to sign up with a unique code or a unique way to sign up per those individuals. So the sites who are doing the vaccinating can be assured that those people meet the criteria.
And Lindsay, I think, Whitney, you have a second question, but Lindsay, you said in your remarks that those 6 groups of comorbidities equates to about 51,000.
Correct. Now that of course is an estimate, but we
Right.
do believe to
Yep.
be about 51,000.
Yep. Whitney, did you have a follow-up?
Of course I do. And then my other question is, does that federal pharmacy plan count against our vaccine allotment like the nursing home plan did?
No, it does not. We have been told that will be coming externally from the federal government. So we're happy to have whatever additional doses they'd like to give the state of Indiana.
Steve with KPC Media.
Afternoon, Steve.
Good afternoon. How are you two doing today?
Doing good. I'll let
Two
Dr. Bach
questions
speak for herself.
I'm doing well also.
Two questions and a data request, if I could squeeze that in. Starting
Sure.
with the data request, I don't know if you have or could get for next week the number of teacher, staff, and student deaths in the state, especially as we've mentioned that teachers won't be a priority necessarily in the next round of vaccines. And then my two questions are school related. Regarding the quarantine rules or guidelines put out last week, a lot of our schools allow students to demask when they're at their desk. And it sounds like to me that would invalidate the quarantine rules. So I just wanted to check that. And then my other test is about the rapid tests going out. From past reporting, we know that rapid tests necessarily aren't the most accurate unless a person is actively symptomatic. So are there concerns about having schools use these type of tests to potentially screen students for illness when we know that they are generally less accurate than a PCR test?
So I'll start with that one first. A PCR test, if that is negative on day 5, 6, or 7, and that's the only, going back on day 8 is the only time where you use a test to help an individual go back. That PCR will 5% of the time miss a person that could potentially become symptomatic in those next 7 days. So that is why when they return, it is absolutely critical that they are masked at all times. They don't participate in extracurricular activities or any type of athletic activities where their mask would have to be removed. When their mask would have to be removed, like to eat lunch, they need to truly be separated from other individuals by that good 6+ or more feet so that that risk time would be limited. When we look at the rapid test, yes, they are definitely more sensitive to pick up a positive test if that person's truly positive, like 64% of the time or so, if the individual is symptomatic. If the individual is asymptomatic, may only pick it up about 36 or 37% of the time. And that is why it's critical that only people that have been totally asymptomatic do this route and that the mask is worn. Because again, if that person is so minimally symptomatic when they go back to school or has no symptoms but could be positive, we 100% believe that that mask will prevent the spread as long as they're fastidious about wearing that. The data request, I'd have to ask my team. We have not looked at any particular group and said what percentage of this group of, people who work in our electrical grid or people who are bus drivers have passed away from this, nor have we looked. We have had, fortunately, thankfully, very limited, minimal deaths in our children, period. So that would be, highly unlikely. So I'm not sure if that's a data request that we can do for you, but I'm happy to look further into that. And was there a third, or did I cover them all? Did I miss one?
If students demask when they're at their desks, does that invalidate the quarantine rules?
It really does. It really does. That safety of wearing your mask. And again, this is specifically in the classroom, right? In the classroom, doing your very best to socially distance at least beyond 3 feet, wearing your mask at all times. Our data from other states surrounding us and the CDC data shows that it is incredibly rare for individuals to get infected. So that's why it's important.
Eric with WIBC.
Good afternoon, Eric.
Good afternoon, Governor. I also have 2 questions. My first, I think, is probably for Dr. Weaver. And this is something I had asked about a few weeks back, but instead of being hypothetical, this is now real. And that's the Johnson & Johnson vaccine. You said 85%, that's still well below the 95% for Pfizer and Moderna. So my question is, do patients get any agency in which vaccine they receive? Is there a way to sign up for one or the other, or do you just get what you get?
I think an important thing, it's a great question. I think an important thing to keep in mind is that 85% is excellent for a vaccine, right? So we're excited when the flu vaccine is 60% effective. And the other really important thing to keep in mind there is that there were no hospitalizations and deaths. And that has been our primary goal with our vaccine plan from the beginning. So at this point, no, people still cannot, decide which vaccine they're going to get. The great, again, benefit of the Johnson & Johnson is it is that one-time dose. So you get it, and then 28 days later, and then reports that we know so far that efficacy continues to build over time. But just at 28 days, you get to that 85% effectiveness and no hospitalizations and no deaths. We'll have to see if the CDC makes any other further comments once we're able to really dig into the data from Johnson & Johnson, if there are any other recommendations around particular groups getting that vaccine.
You might just very quickly before we get to Eric's second question, Lindsay or Dr. Box, talk about the difference between J&J. I mean, first of all, this is like the first time I can remember where we actually know the names of the manufacturers of these vaccines, and we're wanting to decide if we pick or choose based on an 85 or a 95. But you want to talk about just the difference, but what a potential game changer J&J could be to add to the total mix because of its unique storage, et cetera.
Right. So J&J, as Dr. Weaver mentioned, is a single-shot vaccine, and they are doing some studies about an additional booster shot. But one thing I wanted to point out about efficacy is that J&J was around testing when many of these covariants, these variants that are more transmissible, came out, versus Pfizer and Moderna had really completed their trials. So in the face of these other variants, we believe that the Pfizer and the Moderna and the Novavax and Johnson & Johnson all will have some decreased efficacy with these variants. But the important thing is, Dr. Weaver keeps pointing out, is it prevents hospitalizations and prevents deaths. And we need to think about the fact that on a good year, about 40 to 60% of the time with the influenza vaccine, we get protection from moderate to severe disease. As we were talking about the J&J vaccine, I think it's not only a one-shot dose, but it can be refrigerated. It doesn't have to be frozen, and it doesn't have to be in an ultra-low freezer, which is really important. It doesn't have to be reconstituted at the site, which is incredibly important because that makes it even more difficult. So all in all, we kind of thought all along this might be the workhorse vaccine and really good to use for those populations that we know are going to be hard to get back sometimes for the second dose.
Love it. Eric, you had a second or a follow-up?
I did, and this one is for you. The House this week passed the bill modifying the Emergency Powers Law. We've talked about that before, but they added a couple of things that we haven't, which would be the ban on restricting churches in any way, and the requirement to go to the county commissioners for local ban or local restrictions rather that are stricter. Are those provisions that you're okay with, or are you going to be talking to the Senate about getting those stripped out?
Well, I'll continue to talk to both the House and the Senate, and again, they have accomplished a lot this session. I don't want that lost on anyone. Many of them are working around the clock, doing a lot of good work on all of our behalves. I continue to express my. I went to Pike High School. I went to Hanover College. I didn't get a law degree at either of them. But I start with the Constitution. I mentioned this last week, and I first want to make sure anything that is done passes constitutional muster. And while a lot of things have changed over the course of this last year, Article 4, Section 9 of our Indiana Constitution, which I took an oath to uphold, hasn't. And so I think I want to make sure that we start from a place as we're seeking to do good, that is constitutional. And so before we get into all the line items of whether I agree or disagree, I do share their concern that we're all in this together, and I want to make sure that we're able to get out of this all together. And I'm pretty darn proud of, I know she's sitting here and she's sitting there, but I'm pretty darn proud of the way that our team has sailed through this storm to date. And you can take a lot of different measurements in that evaluation, and it's of course currently our vaccination process, but it's also when I'm talking to other governors around the country, when you look at the economic side of our ledger, that's so important, so that we can then in turn help folks who have been disproportionately harmed. In addition to losing loved ones. And when, Dr. Box mentioned we're north of 12,000 people, this is a number that just sticks in my craw. I mean, it is hard to shake a city the size of Martinsville or Madison or Lake Station gone. That's about 12,000 people, if my memory serves me correct. So I want to make sure that whatever changes that we make, first and foremost, are constitutional. And I think we all share that, but we're coming from it from a lot of different angles. And then we can get to the line items, but again, I'll end where I started. We got a lot of, we're in the second quarter of this session, and we're going to do a lot of good this session during a very difficult time for our country. And Indiana will stand out, and I think we will arrive at a place that we prove that we can accelerate away from this pandemic.
Meredith with WLFI.
Good afternoon, Meredith.
Good afternoon, Governor. Can you hear me?
Yes, ma'am.
Perfect. Okay, so my question is in regards to when you guys open the vaccine up. So who will be chosen first? Will it be people who are 50 and over, or will it be people with comorbidities, or is it just going to be kind of a first come, first served basis? And then on top of that, Dr. Box, last week you had mentioned that women are getting vaccinated at a higher rate than men are. I was just wondering if you have any data that you could share about that.
Ooh, yeah, it's brutal if you're me.
Yeah. I am sorry.
I think it's 62% female and 38% male.
60-40 almost, yeah. I'm sorry I don't, but I will bring that specific data, and it is on our dashboard. If you go to the rshot.in.gov or coronavirus.in.gov, you can find that actual breakdown there. But I just don't, off the top of my head, remember the exact numbers. The other question was more.
Lindsay?
Yeah.
Yeah, so first we're going to go to the 60 to 65 would be our next step. And then we'll probably still break down into 5-year increments, again, based on how much vaccine we get. Those comorbidities will be a rolling process. Like I said, many of them have to have specific timing around when they can get the vaccine. So we've already been in communications with their providers and leaders across the state on starting to make sure that we're setting up the best process where they become aware that they are eligible and then they can get connected. So being about 50,000, they're going to be able to, kind of just roll through as we're continuing to expand by age.
Yeah, not to belabor the point, but just to put it in perspective, 60 to 64, there are 431,000 Hoosiers, 60 to 64. 55 to 59, there are 446,000. 50 to 54, there are 412,000, plus the 51,000 that we talked about with comorbidities, those 6 comorbidities. So we're being very methodical about this. The good news is, though, and I want to go back to that 211 and Zotec, the way that we're scheduling appointments here is accommodating both the consumer, the person wanting to get it in their arm, and our supply.
Dylan with Chalkbeat.
Afternoon, Dylan.
Good afternoon, Governor. I've heard that Dr. Box has said some special education teachers are eligible for vaccines now. Are special education teachers eligible to receive the vaccine as qualified healthcare workers?
So what I have said, and I've been trying to message this as clearly as possible, we have many aides that are in the classroom with our special education students, and they do a lot of the suctioning and the close medical type care and work. And so if a particular teacher has that ability in their classroom, they would not necessarily be eligible. However, in some of our smaller schools or more rural schools, they may be doing all of that for that individual student. And under those circumstances, I would most certainly want them to be able to get vaccinated.
Brock Turner, WFIU.
Afternoon, Brock.
Good afternoon, Governor. I have 2 questions here, one for you and one for Dr. Box. Specifically, Dr. Box, in regards to contact tracing. I know ISDH has been employing a lot of state-run tracers. Can you talk about any changes that we might see to that program or readjustments as we move to lower cases? Do you anticipate switching to a more active approach or anything like that?
Well, we have continued to be actively engaged with all of our positive cases, reaching out to them with text messages and asking them to call us back and reaching out for phone calls to reach them. As far as close contacts, many of them were actually texting them, giving them the link to resources for information about what a close contact is and what they need to do and when they would want to get tested, and then offering them the ability to call us, but not always necessarily calling them directly. However, our local health departments are on the same Microsoft platform that we are, so they have that open case and oftentimes are the additional work to address those individuals within their communities. We already, with the decreased number of cases, have begun to use some of our Maximus call center individuals to help with not only reaching out to individuals in our older age groups that we want to get vaccinated, but to do additional education, answer additional questions, and to assist with schools. So we have already been kind of expanding their abilities and expanding their education so that they can cover more things that we need covered with a call center.
And you had one for me, Brock?
Thanks for that. I do, yeah. Thanks for that clarification, Dr. Box. A non-COVID related question for you, Governor. There's a committee hearing this afternoon that would allow for permitless carry of handguns. Is that legislation that you would sign if it were to pass both houses, or would you consider a veto for that?
Well, like I said, we've got a second half to go, and so I want to see what the bill looks like at the end of the day. Obviously, I'll just say this. Hoosiers have a constitutional right to carry, and they do as we speak. That will continue. Hoosiers have the ability, obviously, to do that in a free fashion, cost-free, and that will continue. As to the folks who are going to share their own personal testimony and own expertise for the conversation, I'll be watching it and paying close attention to what does or does not come to my desk, and I'll be very clear when I start to see the bill's language become a bit clearer as well. By the way, I should say that you didn't ask this, but someone else did. I was just handed the exact percentages of female-male.
Thank you.
Thank you, Rachel. 61.1% female, 38.6%. So if you round up and down, it's 61-39.
John with WFPL.
Good afternoon, John.
Hi, Governor. I've been able to tune in the past couple weeks, so I'm sorry if you've touched on this a few times, but I wanted to jump back a couple questions and take a broader look at these legislative attempts to restrict some of the emergency powers. Obviously, you're not the only governor in the region that has been dealing with this, so I wanted to get your kind of a broader look at just your overall thoughts on these efforts and how it could affect the state's ability to respond to the pandemic.
Well, it depends. I mean, it depends on what the process is, and obviously, I have always and always will keep an open door and open lines of communication. And as I've mentioned, and the leaders have acknowledged throughout this process, prior to January, when we came back into session, when the Constitution requires and states when. I asked, was it time, and if we, for a special session, there was not an interest in that, and I can understand why, because you don't know what would come from it unless you come for a very specific purpose, and so I'll continue to keep an open mind and keep folks abreast of where we are, and we do that through various different avenues, whether it be the budget committee, whether it be conversations that I have, whether it be meetings that are requested to keep folks and associations around the state abreast of what we are doing and why we are doing it. We have I would say almost a unlimited amount of opinions on what we should and should not do, and I don't for one second think that any of the 150 members or the mayors or county commissioners or local health departments would have made the exact same decisions that we make on a day in, day out basis. And it's just, factoring in the local and the federal input and digest it and then make decisions on literally a daily basis. I'm more than willing and wanting to share that info and express just why we make the decisions. That's why we remain accessible and very transparent, and not just on a website, but on a daily basis. And so I have appreciated members who have expressed their wanting and willingness to be more of a part. I want to know exactly what that means and to what end and how it would affect me. And obviously, when you look at some of the ideas in the beginning and some of the ideas now and some of the ideas that may be around, a month from now, they change. And so we'll remain engaged. But what I don't want to have happen is, and you mentioned I'm not alone. You're right. And I remain in contact with 49 other governors, plus the territories for that matter. We're in a unique position, and I express this to the congressional delegation because they've got some important votes before them as well that have an impact on us. plea was to make sure that we're targeting this assistance and help that's coming, appreciate it, that's coming to the folks that need it. Because when you think about a positivity rate, not just a positivity rate of 16.5 a month ago and a 6.2 today, or you think about an unemployment rate of 17.5 and 4.3 today, or you think about a January revenue reported $245 million north of what was projected in December of 2020 of where we are today, a lot's changed for the better in the state of Indiana. And I want to make sure that we continue that momentum, and I don't want anything to get in the way of that momentum or slow it or stall it. And fortunately, my conversations with leaders in the General Assembly not only recognize that, they're doing a lot of work up there right now that are going to help us pull away from the pack. And I appreciate that. So we'll have these conversations about where we agree and disagree in specific pieces of legislation. Am I going to get my way 100% of the time? Call my wife. She can give you the real answer. While I'm ranting here, I don't have the idea. Was pushing a bill for pregnancy accommodations in the General Assembly, and it's not going to come to fruition. That's been message received from upstairs. I'm going to support a step in the right direction. But I'm also looking at ways to make sure I can be persuasive in the future. And so to that end, we're working on right now an executive order for state employees, all 30,000 of them, to practice what I preach and prove and then take out to small, medium, and large businesses and say, here's what we're doing. Would you sign up for this now? Because a lot of them are small, medium, and large, including members in the General Assembly with their small businesses. And I've spoken to Sharon Nagel and Cindy Zemke, who own their own businesses and do this already. And so hopefully we'll be able to prove through various means issues where we are not 100% in line with one another. But that's true every single year of going back to 1816. So I don't consider myself fortunate or unfortunate in that regard. It just means we got more work to do. I'll quit filibustering.
Our final question is from Mark with the Terre Haute Tribune-Star.
Hello, Mark. Good afternoon.
Good to see you. Thanks for your time. Appreciate it very much.
Thank you.
One of the outlets that Hoosiers have had through the pandemic to get some diversion is in the outdoors. And it's hard not to look at Senate Bill 389 and wonder if Governor Daniels' stated goal 11 years ago with Healthy Rivers of becoming a national leader in wetlands might be imperiled by that bill. What's your concern about it?
Well, I am, and you saw a couple of our agencies, plural, more than one, testify in that regard. And again, these are agencies with the expertise on not just the intended consequences of which you may be speaking to, but the unintended consequences as well. I'll continue to work with members and leaders in the General Assembly. I spoke about this morning, and my concerns with it. So I hope, and I'll meet with the stakeholders too, because again, I'm not trying to slow down our momentum. I want to do it responsibly, and I don't want it to imperil, to use your word, or jeopardize any of the progress. We're making a ton of progress on this front, and one thing that we do know is, and you state. Folks are taking part in outdoor activity more so than ever, and it's also helping our economy. When you look at marine production, when you look at RV production, when you look at patio furniture, when you look at try to buy a bicycle, some of these brands of bicycles people are telling me, these are all great things. When you look at the state park attendance and the visits I mentioned at the State of the State, 2+ million more visits year over year. So we want to encourage that. We want to accent that. We want to plant those million new trees, those natural scrubbers. And we're doing that. Did about 220,000 new plantings last year. So we'll continue to make investments. The General Assembly is making these investments in our state parks, second to none in the country, I might add. And so again, we're at this moment of time. Here we are. We're not even to halftime yet, but we all have to balance all of our concerns, and that's what the legislative session's all about. And I look forward to finishing strong in the fourth quarter.
Joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.